So the last thing that we'll talk about is the pulmonary artery obstructive pressure, or wedge pressure. Essentially, it occurs at the tip of this pulmonary artery catheter. So like I said before, this catheter fishes all the way through this central venous catheter that is inserted in the jugular. So when this is being inserted by a physician, as a nurse, you may be able to assist in this procedure, but generally the idea is that they're going to start fishing this pulmonary artery catheter through. So as they start at this distance, they're going to be into the jugular vein. And you would be able to see on your monitor, as you're connected, the changes in the waveform based on its location. So if we start initially, as we insert this catheter, we can look at the waveform and the shape of the waveform. So this is as soon as we connect, what we would see as soon as we can connect to our transducer is just an atmospheric pressure. Then we would move this catheter as we insert it, we would move into the jugular vein. So you can see that some waveforms are starting. As we keep progressing into the right atrium, we will see that the waveform is very similar to the central venous pressure. Because this catheter tip is actually in the right atrium, it's going to display exactly the same waveform that we would have in the right atrium. So that's why they look essentially identical. And then if we continue pushing and threading through, we would end up in the right ventricle. And so now we know here that we're in the right ventricle. This is actually a dangerous place to be because it could cause a lot of dysrhythmias. So we want to move quickly through that one, through the pulmonic vein and into the pulmonary artery. And now we would end up with our pulmonary artery pressure. Now, if we kept moving along past this point, at one point, we would go all the way to obstructing the pulmonary artery. So we don't want to do that. I mean, normally as we're placing the catheter, we will push all the way to know how far we need to go, and then withdraw the catheter a little bit to ensure we don't stay permanently occluded. Now, the other measurement after you've measured your pulmonary artery pressure is actually calculating this pulmonary artery obstructive pressure. And we do so by inflating a balloon that's at the tip here of the catheter, of the pulmonary artery catheter. So I just have a different catheter. It's white instead of yellow, but it's essentially exactly the same thing. So here you can see at the tip here, if you keep a close eye on it, as I inflate this syringe, it will begin inflating this balloon. And this is our pulmonary artery obstructive pressure, so our wedge pressure. And so this is completely obstructing our pulmonary artery. And you can see the size of that, how big that is. So just to keep that in mind, if this were to stay inflated, this would definitely cause necrosis of the pulmonary artery, and the pulmonary artery would essentially tear apart, and your patient would be in much trouble. So what we do with our patients when we are measuring our cardiac output, cardiac index, CVP, pulmonary artery pressure, and our pulmonary artery obstructive pressure, or occlusion pressure, I would go and look at my yellow line here, my waveform for my pulmonary artery pressure. And on exhalation again, I'm going to want to look at essentially the number that I see on my waveform here. It's going to give me a single number because I've completely obstructed the pulmonary artery. So I won't have a systolic, diastolic. I will just have one number as I inflate. So if I'm inflating, you will see on the screen the waveform flatten out. And now this number here, so the 2 or the 3, that would essentially be my wedge pressure. So So sometimes our waveform is not as flat as this, so there's a bit more variation, and we would actually really make sure to measure at the end of exhalation exactly what that number is, using our cursors if we needed to, but in this case this one is quite flat and is really giving us just one single number, and so we would take this number as our pulmonary artery occlusion pressure, also called the wedge. And to keep in mind that because everything happening at the tip of this catheter is really happening, if our catheter is here, if our catheter is approximately here, so the tip is here, it's giving us an image of what's going on here, so on the left side of the heart. And so we often use this pulmonary artery occlusion pressure as an indicator of the left atrial pressure. So similarly to the central venous pressure or the right atrial pressure, it really gives us an idea of the left atrial pressure, and so we would use this this wedge pressure as that number to help us to see if there's any significant differences between right-sided function and left-sided function of our heart.